Hi everyone, my name is Tina and I am a student at Southern New Hampshire University. Today is February the 9th and I am coming to do my physical assessment. This is the area that I'm going to be working in. It is usually either an STD room or a family planning room. I do have my volunteer here already, but I'm just trying to show you everything that I got. I've got my stuff set up and I've got my note. There's my sink. There's the supplies that they use here in this room. Okay, so we are going to go ahead and try to go ahead and get started. I'm going to do a little bit first before you can see what I'm doing. Alright, this is my patient, PW. He is 59 years old and he is going to be my volunteer for today. Is it okay to do a head-to-toe assessment on you?
Yes.
Alright. So I have a curtain here. I'm going to go ahead and close a little bit. It's right here. Sorry. And then I'm going to come wash my hands before I can be ready. Off. All right. And while we came in, we did our vital signs, which were all within normal range. And so what we're going to start doing for right now is we're going to start looking at his face and make sure that it's symmetrical and that everything is even. His eyes are even, his ears are even. We can also go ahead and check some of his cranial nerves. Can you smile for me? Can you frown for me? Can you move your eyebrows up and down? Okay. So we're just going to look at it first and see what it's got. I'm looking at his arms and his skin. I don't see any bruises. I don't see any knots. His legs I have assessed earlier and I don't see any bruising or knots. I want to look at your hand. His trigger's fairly well. It looks good. Okay, can you take your glasses off for me? So I'm going to get my little scope here. And I'm going to put my glasses on. So I can make sure I see everything well. So I'm going to look at your eyes. PWI has a prosthesis on the right eye. So it will not have any reaction, but I'm still going to check it and make sure that the eyelids are good. They're pink and moist. They're redless. And I'm going to go to his left. And it looks good. They're pink. His left one. His eye sclera is white. I am going to look at it. I want you to look right here for me, and that way I can see how your eyes react. And they dilate really nice. They go to a 3 to about a 1. Okay, and I see you with glasses. All right. So once we're doing that, we're going to go ahead and look at the nose. The nose is symmetrical. It's even. I'm going to see if you can breathe out of one. Can you breathe out of that one? No problems on that side? No problems on that side? I'm going to look up at his nose. It looks intact. No bumps, no drainage, no deviated septum, so that looks good. And also, since I've got this already ready, I'm going to go ahead and look at his ears. I'm going to feel his ear. Any pain or anything?
No.
There's no lesions, there's no open areas. And we're going to pull up. His membrane looks well, it's nice and gray. He does have a little bit of earwax in it. I'm going to look at this one. There's no lumps or bumps on this one. And it looks good also. The head membrane is nice and gray. And we're going to look inside your mouth. Can you open your mouth? Ah. There's no red areas. Say ah.
Ah.
Okay, the uvulus is doing good. If I had a tongue depressor, I can mash it down and make sure that he has a good gag reflex. Usually he's gonna feel like he's gonna throw up. He is missing a couple of teeth on the bottom teeth, but it's been gone for a while and it looks like it's healed. Any problem chewing your food?
Yeah.
Okay. So I'm gonna put this in. I'm gonna put this up. Knock my paper down. All right, so right now what I'm gonna do is I'm gonna check your frontal side cavity. Any pain or pressure up in here?
Nope.
Okay. Any pain or pressure up in here?
Nope.
Okay. All right, so I'm gonna check. Can you put your head up and back? Check for movement. Okay, he moves well. Can you put one ear to your shoulder and then to the other? Any pain?
No.
Discomfort? Okay. So I'm gonna have you sit your head up a little bit, or just I want to look for his jugular veins and see if there's any different. Nothing looks standing out. I don't see any distension. This is the normal rate. It's like a +2. And his right side. It feels good. It's a +2. So while we're still up this way, I'm going to listen to his temporal. Okay. It's nice and strong. Nice and strong. Listen with the bell. Nice and strong. It's like a +2. I'm also going to listen to his jugular. Sounds good. No bruise heard. Okay. All right. Checking his throat, see if anything like any goiters or thyroid problems. Can you swallow for me? Any problems swallowing food or water or anything like that?
No.
No? Okay. So I'm going to check some lymph nodes. I don't feel any knots or lumps. some axillary. Okay, that sounds good. That looks good so far. So now what I'm going to do is, can you kind of shrug your shoulders and see if they go up? Okay, so we have movement, and that's really good. And earlier we had tested some of his nerves by doing his eyebrows and smiling. Can you stick your tongue out at me? All right, can you wiggle it? Go side to side. Okay, so that's okay. So most of his nerves, looks his cranial nerves are doing well and intact. Okay, so what I'm going to do now is I'm going to listen into your heart. You can put your glasses on. So we're going to go down here and go to the second costal, and we're going to listen to his apical. Okay, and then we're going to go to the side, and we're going to listen to his pulmonary. And we'll go down one and listen to his earth. And we'll go down and his tricuspid. And we're going to go listen to his microvalve. It sounds good. I didn't hear any, I heard S1 and S2, and I did not hear any gallops or rubs or anything like that. And I'm going to listen the other way. Back again. And that's mitral valve. That sounds really good. Okay, so that sounds really, really good. And what we're going to do is I'm just going to try to make sure our sight sounds good. Sounds good. Okay. Now we're going to listen into your lungs, okay? I want you to take a deep breath for me. Okay, that sounds clear. To the base. That sounds good. No crackles, no rubs, no wheezing. So that's a good thing. So I'm going to come around here and listen to the back. Okay, take a deep breath. Sounds really good. No crackles, no rubs, no wheezing. Okay, so I am gonna do some percussion here. I'll resist it. No, don't on a minute. Okay. All right. Do you have any kind of breathing problems?
No.
No? Okay. Any problems with taking deep breaths when you get active or anything?
No.
Okay. So no health concerns?
No.
Okay. So what I'm going to let you do is, I am going to let you lay back and I'm going to put your feet up for you. I'm going to listen to your belly, okay? Put this back a little bit. I want to make sure that you're getting it. Okay. All right. So I'm going to listen first. All four quadrants. So I'm going to start really gentle. Right lower. Right upper. It's normal. Left upper. Normal. It's normal. I'll listen to the aortic. Okay, there. And the iliac. Listen to the arteries. It's okay. I don't hear any bruise. Okay. Do you have any kind of stomach pain?
No.
No? So I'm gonna lightly touch you, okay?
Okay.
You let me know if anything hurts, okay? Anything hurting? So I'm gonna try to listen percussion, see if I can hear anything. To right lower. To the right upper. His stomach is flat. It's got a little concave right there. He has lost a bunch of weight since the beginning of the year. He had gastric sleeve done in November, so we still kind of watch out, making sure we're not pushing down too hard while we're doing that. I don't hear any mass dullness. It sounds really nice. Okay, that sounds good. So I'm gonna do a little bit harder now to make sure I don't feel any kind of masses or lumps or bumps or anything, okay?
Okay.
If anything hurts, then you let me know.
All right.
Anything hurt up in there? Take a deep breath for me. Alright. Do not feel the liver. Anything up in here?
No.
Not feeling the spleen. Okay. Now I'm going to try to see if I can feel the kidney or anything, okay? So if anything hurts, let me know.
All right.
I don't feel any masses or anything like that. I'm going to go to the other side because I can't reach that one too well. Anything hurt? No. Okay. Do you have any problems urinating?
No.
What about when you start a stream? Is it slow to start?
No.
No. Do you have any problems like having bowel movements?
Since I've had surgery, sometimes I do.
Okay. So how often do you have a bowel movement?
About every 4 days.
About every 4 days, okay. And what are you doing to keep yourself having a bowel movement?
I'm following the recommendations of my surgeon and my dietitian to take a fiber tablet every day and try to increase my fiber intake and my water intake.
Okay. Are you active?
Yes.
Okay. So I'm gonna bend your knee. Is that okay?
Yes.
Okay. Any problems with any knee pain?
No.
I'm back here. I'm going to go ahead and feel for popliteal pulse. And I do feel that. You can put down that. I don't see any swelling or edema in the legs. And no sores on the skin. I'm going to bend this one up. Any pain in the knee?
No.
Get your popliteal and check it. You've got a nice pulse, it's a +2. No swelling, no edema. Okay. And I am going to try to feel your pedal pulse in here. And I can do that. So in a few minutes I'll probably have to take your shoes off so I can see your toes, okay? He has pulses back here and the heel. Alright. So I am going to have you sit up. I'm going to put this in so you can put your legs down. Okay? Feel alright?
Yeah.
Any problem with dizziness or anything like that?
No.
No. Okay. Do you mind taking your shoes off?
No.
Alright. So I'm going to look at your hands first. There's no clubbing of the fingers. Can you open and close your finger?
Yes.
Okay. I'm going to see your capillary refill. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. So that looks good. Look at your other hand. 1, 2. 1, 2. Good capillary. Okay. Can you spin your hands?
Yes.
Any problems with any joints in your fingers?
No.
No? Can you put your hands out? And put your wrist up. That's going to check your wrist and making sure that you have good movements. Can you put it down? Okay. Can you lift your arms up while I'm pushing it? Okay. Same thing. I want you to push down. All right. And I want you to squeeze. I want to try your strength. It is good. No problems. Okay. My skin is warm to dry. It's very good. No problems there. I'm going to go ahead and try to get these pulses while you're here. Your brachial pulse. There's your brachial pulse. Your radial. Okay, I'm going to find that. Okay, no problems there. Okay, so I'm gonna try some other stuff with you so far, okay?
Okay.
So, this is to see how your sensory is. Can you close your eyes? Put out your hands. Can you tell me what that is?
Feels like a cotton ball.
Okay. Can you feel that?
Feels like a key.
Key. Okay. Can you feel that?
Yes, it's a cotton ball. Still a key.
Still a key. Okay. All right. I want you to tell me if you feel something soft or hard.
Okay. Yes.
What is it?
It
Soft
was
or hard?
soft. It was soft. 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 Hard. 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 That was hard.
Okay. Keep your eyes closed.
Okay. That was hard.
I'm just checking on his feet to see how
It's
the
hard.
senses are there.
That was soft. Soft.
Soft. Okay. Very good. All right. I want to try the Bensko reflex. Yep. His toes curl in, so that's a good sign. Okay. Good reflexes. You might have to sit back just a little bit for I want to see if I can get some of these reflexes in, okay?
All right.
Okay, you all right? Okay. Good reflexes. All right. Okay. Got reflexes. Alright. Close your eyes for me. I'm just going to try some of your sensors again.
Okay.
Can you tell me what this smells like?
That's definitely rubbing alcohol.
Okay. Good. Alright. Do you want me to put your shoes back on, or do you want to? I want to see how well you stand and everything.
Yeah, put my shoes on. Put them on. I can put them on. Thank you.
I want you to make sure that you're even when you do that.
Okay.
So while you're doing that, can you count backwards by fives? Like from 100 down, can you count by fives?
Sure. 100, 95, 90, 85, 80, 75, 70, 65, 60, 55, 50, 45, 40, 35, 30, 25, 20, 15, 10, 5, 0.
Okay. So he's able to do the numbers, and while he's moving all of his muscles, there's no problem moving. Everything looks even. Okay, so I am going to let you stand up for a second.
Okay.
Okay, stand up. All right. So we're going to try Holman sound. I want you to close your eyes and put your arms out for me.
Okay.
Any problems?
No.
Any dizziness?
No.
Okay, he looks steady, so that's a good thing. Okay. Are you able to touch your toes? You can open your eyes now.
Okay.
Can you touch your toes for me?
Yes.
All right. No problems there. I'm feeling while you breathe. That way everything looks even. No problems. Okay, I don't see anything sticking out. I'm gonna look around you the other side. And I'm feeling it back, everything's symmetrical. Any problems with your back?
No.
Okay. While you're standing, you can lean against it, but we're going to try your balance.
Okay.
Can you take your heel and go it down your front of your leg? Okay, that balance is good. Can you do the other one?
Yes.
Okay. All right. So overall, he looks like he's well. There's no abnormalities found. He has good balance. Who's the president for the United States?
Joseph Biden.
Okay. What did you do for your last birthday?
Celebrating with my family.
Okay. You may have a seat.
Okay.
So he's alert oriented ×4. His balance is good. His skin looks good. Overall, he's doing in good shape. Okay. I want to thank you for assisting me, and I hope you have the rest of a good day.
I appreciate it.
All right.
You have a good one.
All right. So I'm going to take these off, and I'm going to wash my stuff. I do have one more other thing for you to do. Can you read that and follow directions?
Fold the paper and place in trash.
Okay. There you go. So that was good. So thank you so much for coming today.
Thank you, nurse.
And that's it.